Hello, Diaz here, founder owner Greenwood Dental. Welcome back to another video. Today I would like to give you guys my opinion behind the reason why some teeth are gray in color or gray in shade. The gray shaded teeth are the most difficult or most challenging or most frustrating shade to brighten up or to lighten up to make it look a little bit more pleasing to the eyes aesthetically as far as the shade is concerned. From my 23 years of dentistry, practicing dentistry, part of my understanding of such gray stain or color to the teeth is half of it is what we were taught in dental school, which is, again, it's science supported. And the other half is observational data that I've been collecting for the past 23, almost 24 years. So most of the patients that I see, having a gray tooth is very unattractive to them because dark teeth is linked or dovetailed into the thought that the tooth is unhealthy or the tooth is diseased or there is a problem with the tooth or something's going on. It's unnecessarily true in many cases. I can't say for most cases. The most common understanding of a gray tooth is the tetracycline stain. Tetracycline is a type of antibiotics that is given to certain bacteria infection. The cycline family of antibiotics is used mostly or especially for Lyme disease. A lot of patients will take that for it in order to clear the Lyme disease. But if a pregnant mother or expecting mother takes tetracycline, which I don't think it's a practice that is continuing these days. I think that we stopped in the 80s or the 90s to give tetracycline to pregnant moms for many health reasons. But one of the reasons that we also find out the link between taking a tetracycline antibiotics and the gray teeth in the newborn. When that newborn gets into the adulthood years and you get the adult teeth, those teeth will turn into or come out to be super gray. And the grayness, the shade, is not the enamel itself, it's actually the inside or under layers of the enamel, which is the layer behind the enamel that turns gray for some reason. They are frustrating because, again, we are much more, white means it's healthy, white means beautiful, white is more pleasing to the eye, white means more aesthetic. So the other reason would you have gray tooth is if you have a silver filling and that silver filling is leaking underneath into the deeper layer of the tooth. And the difference between tetracycline stain and amalgam leakage is very localized. It pretty much restricted within the parameters of the filling. Unfortunately, the tetracycline stain, you can see it through the whole mouth with the special adult teeth, and you can see the little striation, which is the layers. You can see gray, and then you can see white, and then you can see gray. It's embedded inside the deeper structure of the tooth. What to do about the gray? If the gray stain or the gray color is due to the amalgam, replace the silver filling obviously with a tooth color filling. If it's tetracycline related stain or related gray shade, then you can do the bleach, which I talked about in my Zoom video. The best way to bleach teeth like that has to be an in-office whitening system, so we can control the environment and make sure that the effectiveness of the chemical to brighten it up. How bright do they get? They get brighter. You can never turn a tooth that has gray inside, gray stain inside of the structure of the tooth to brighten up that much, because the bleach does not penetrate that deep inside the tooth in order to bleach out all the gray. But please, if you're concerned about that, reach out to your provider, talk to your dentist, call me, put a comment on YouTube, reach out to me, and then we can take a look at the degree of the grayness and what are your options to make those teeth brighter and whiter and pleasing to the eye. That's it for today. I hope you guys are well. I wish you guys a happy dental health, and DS out.